Hello everyone. Today we are going to discuss about individual and group therapy. Patients suffering from physical illness are given specific treatment because the causes are specific and the signs and symptoms are also specific. In a psychiatric setting, the treatment may not be so specific and most patients are given more than one treatment. These treatment methods vary from patient to patient. Some patients they do not want treatment and some people they will not cooperate with the doctors and nurses. Here, the nurses has an extremely important role to play in the treatment of mentally ill, and also nurse, she is the one who has closer contact with the patient than any other members of the hospital team. In psychiatry, we have physical therapies and psychopharmacology. So this individual and group therapy comes under physical therapy. This is one of the physical therapy. So based on the number of clients, psychotherapy is classified into two types. It is individual psychotherapy and group therapy. So individual type psychotherapy, where therapist will treat individual client, and group therapy, 8 to 10 homogeneous group of client will be there. So there will be a fixed time for therapy. This is the definition of individual psychotherapy. So it is a method of bringing about change in person by exploring his or her feelings, attitudes, thinking, and behavior. And here in this individual psychotherapy, this therapy is one-to-one basis we can conduct. So therapist can treat one patient at a time. So this therapy helps to understand themselves and about their behavior. And through this therapy they can make so they will change their own selves, their personal changes. They may observe, and they can improve interpersonal relationships, and it will help the people, it will help the patient to relieve from emotional pain and or unhappiness. And these are the aims for individual psychotherapy, to modify the maladaptive behavior. So when we found maladaptive behavior for the patient, by applying this therapy, we can change their maladaptive behavior into adaptive behavior, and also yeah, can improve interpersonal relationship to get relief from stress or unhappiness and to make personal change. These are the major aims and indications. Stress related disorders such as acute stress reaction, PTSD, and adjustment disorders, and alcohol and other drug abuse disorders, cocaine and amphetamine use disorders, sexual disorder and marital disharmony, such as gender identity disorder, paraphilia, sexual dysfunction. So these are the indications for individual psychotherapy. And so here we are going to discuss about process, therapy process. So when the client comes for the OPD, so what is the therapist role is? Therapist first he has to observe the client behavior, and he should assess the client is indicated for psychotherapy. So if the client is indicated, what he has to do is first he has to fix the time for the therapeutic schedule, venue, date, and time. Everything he has to do, and he has to provide so conductive environment, so with comfortable seating for the patient, and the patient is encouraged to discover for himself the reason for his behavior, and the therapist he has to listen to the patient and offers explanation and advice when necessary. So this method helps the patient to come to a greater understanding on self and to find a way of dealing with his problem. This is the process of individual psychotherapy. So then stages of psychotherapy. There are three stages: introductory stage, working stage, and termination stage. The first stage is introductory stage. This is first stage. So in this stage, the client and the therapist meet and begin to work together. So here it involves taking a history of the patient, and it includes this history includes any medical problems or and current medication what the patient is taking. So everything has to be recorded by the therapist. And also, if the client is referral, the therapist may already have the information. So during this introductory stage, the therapist forms some preliminary ideas about the client's needs. So together, client and the therapist discuss issues such as the length of time therapy will require, meeting dates and location and fees and everything they have to discuss in the first stage, introductory stage. And the second phase is that is the working stage. So this stage of the therapy, the client is able to become more trusting. So here the therapist has to develop trustworthy relationship with the patient. So the reason is, so then only we can make the patient to talk more and more. They will ventilate their thoughts, feelings, and the behavior, so that lead to the pain or problems. So this phase is the very important phase. There's a working phase. So this working stage is pakka. Then it's very easy for us to come to know the problem of the patient. And the last stage of working through is reached, which means that is termination stage. So in this is the final stage. So in this stage of therapy, the working through stage, this is the working through stage. So the client achieve a higher level of understanding, so or the self relationship with others, so being to try out new ways of perceiving, thinking, feeling and behaving. And client will develop so new coping skills. They have they have capacity to solve problems in this stage, termination stage. So these are the three stages: introductory stage, working stage, and the termination stage. So then we will be discussing about approaches. There are four approaches we have in this therapy: psychodynamic therapy, humanistic therapy, and behavioral therapy, cognitive therapy. The first one, psychodynamic therapy. So this is based on psychoanalytic therapy, psychoanalytic theory. And here the assumptions that when a patient has insight into early relationship and experiences the source of his or her problems, they can be resolved. And based on this humanitic therapy, so this humanistic therapy centers on the patient's view of the world and his or her problems. And this behavioral therapy does not foster awareness, but it emphasizes the principles of learning with positive or negative reinforcement and observational modeling. And this cognitive therapy focuses on identifying, correcting distorted thinking patterns that can lead to emotional distress and problems behavior. So here in this cognitive therapy, patients are taught problem solving skills and stress reducing methods. So from this, the patient can learn how to solve problem. So through the cognitive processing, these are the four approaches we have in individual psychotherapy. So next we are going to discuss about group therapy. So group psychotherapy is a treatment in which carefully selected people who are emotionally ill meet in a group guided by a trained therapist and help one another affect personality change. So here the group psychotherapy, it is a treatment of psychological problems in which two or more patients interact with each other on so both an emotional and cognitive levels in the presence of one or more psychotherapists who serve as catalyst or the facilitator or the interpreter. So selection of clients. So always we should select homogeneous group. homogeneous group in the sense. So either we can select male patients as a group or female patients as a group. Other same characteristic features, same problems, and adolescents and patients with personality disorders, families and couples where the system need change. So those kind of peoples we can select for the group therapy. And then contraindication. So antisocial patients, patient who has antisocial behavior. So we cannot take those kind of patients for group therapy. So because they will be having violent behavior, so it will affect the group members. We cannot predict when the people will do what they will do, that we cannot predict. So antisocial patients we cannot take for the person for giving this group therapy. And actively suicidal or severely depressed patients, whatever we are telling or whatever we are teaching to them, they will not understand what we are doing. And patients who are delusional and who may incorporate the group into their delusional system, people, which means people those who have delusional idea. So those people also we cannot include for this therapy. And a group size. So for a group therapy, optimal size for group therapy is 8 to 10 members, and the frequency and length of the therapy. Most group psychotherapists conduct group sessions once in a week, and each session may last for 45 minutes to 1 hour. Then approaches to group therapy. The therapist role is primarily that of a facilitator. So he should provide a safe, comfortable, and atmosphere for self-disclosure. Focus on the here and now. So we cannot focus the previous problems or the past history of the patient. So we should focus here what is going on here and now, the present problem. Use transference situations. It is mainly for develop insight into their problems. And protect members, which means protect patients, the members from verbal abuse or some other issues. And also we need to set limits of their behavior so as to protect other group members also. We need to set limits to protect group members and provide positive reinforcement. So if there is a need, if we found whenever we found the appropriate behavior, the positive behavior, we can give reinforcement. This will gives ego support and encourage future growth for the patient, and develop the ability to recognize. So when a group member is fragile, he should be approached in a gentle, supportive, and non-threatening manner. And we need to use silent effectively to encourage introspection and facilitate insight to the patient. And laughter and moderate amount of joking should be there. These are the therapeutic factors involved in group therapy. Sharing experience, support to and from group members, socialization, imitation, interpersonal learning. These are the therapeutic factors involved in group therapy. So here the sharing experiences, this will help the patients to realize that they are not isolated and that others also have similar experiences and problems. So hearing from other patients that they have shared experience is often more convincing and helpful than reassurance from the therapist. Support to and from group members. The second one is support to and from group members. So this is receiving help from other group members can be supportive to the person helped. So receiving help from other group members. And socialization. So socialization, so which means this process can be helped by trying out new ways of interacting within the safety of the group. And imitation. So it is learning from observing and adopting the behaviors of other group members. This is learning and learning from observing and adopting the behavior of other group members. This is imitation. And interpersonal learning. This is the final factor, interpersonal learning. So, which means learning about difficulties in relationships. How we can make the patient to learn difficulties in relationship by examining the interaction of individuals with other members of the groups. So these are the 5 therapeutic factors which involved in group therapy. So then some techniques useful in group therapy: reflecting or rewarding comments of group members, asking for group reaction to the member statement, asking for individual reaction to member statement, pointing out any shared feelings within the group, summarizing various points at the end of the session. These are the some techniques which will helpful, which will useful in group therapy. So, in this about this group therapy, so this group therapy plays a major role in the rehabilitation of the mentally ill individual. So, group therapy, this mainly it gives an opportunity for immediate feedback from the patients and the peer, and it will give the chance for both patients and therapists to observe the patient's psychological, emotional, and behavioral response towards a variety of people. And also it will help the people patient to master communication and interpersonal skills, and it will develop problem solving skills, decision making skills, and assertive skills. So this both individual therapy as well as the group therapy, so the both plays an important role in psychiatry. Thank you.